Good morning, good afternoon, good evening. Welcome from Damascus. My apologies for the delay. My name is Nika Alexander. I'm part of the communications team at the World Health Organization. For the press conference today, we have with us Dr. Tedros Adhanom Ghebreyesus, WHO Director General, Dr. Michael Ryan, Executive Director, WHO Health Emergencies Program, Dr. Iman Shankiti, WHO Representative in the Syrian Arab Republic, and Dr. Richard Brennan, Regional Emergency Director, WHO's Office for the Eastern Mediterranean region. Dr. Tedros, over to you.
Thank you, Nika. Good afternoon. I'm speaking to you today from Damascus. I'd like to start by offering my sincere condolences to the Syrian people for the enormous losses they have sustained. I have seen firsthand the devastating impact of the earthquake and listened to the stories of survivors. In Aleppo yesterday, I met Noah, a girl who lost both her parents and suffered a broken arm when their 6-story apartment building fell. Noor is just one example of an unfolding tragedy that's affecting millions. The compounding crisis of conflict, COVID, cholera, economic decline, and now the earthquake have taken an unbearable toll. I also offer my deep respect and admiration to the survivors and responders, including our own WHO staff. I have been so impressed by the dignity, faith, and hope expressed by so many survivors and by the dedication of the responders. WHO is with the Syrian people and with the people of Turkey. National and international organizations, neighbors, mosques, churches, and community groups are racing to provide people with a place to sleep and feel safe, with food, clean water, and medical care for injuries resulting from the earthquake, but also for other health needs. At one of the shelters we visited yesterday, a mobile health clinic supported by WHO was distributing medicines to people who had come in for support for a range of conditions. Many people had headaches, difficulty sleeping, and anxiety. WHO and other organizations have trained community workers to offer rapid mental health support, but much more is needed. In addition, WHO is providing medical supplies and working with partners to provide specialized medical care. And so far, we have distributed 110 tons of medical supplies to affected areas throughout the Syrian Arab Republic. A flight is scheduled to reach Damascus tonight with specialized emergency health supplies, which are vital for frontline workers as they manage casualties. In addition, we're supporting surge capacity of frontline specialized medical teams. On the morning of the earthquake, WHO immediately accessed its prepositioned supplies in the Northwest and Aleppo, making treatment of major injuries immediately possible. After checking on the welfare of their own families, our staff immediately went to warehouses to start distributing supplies to health facilities. WHO is working across all affected areas and further scaling up across the country, including in the Northwest. WHO immediately made available $16 million from the contingency fund for emergencies for the response in both the Syrian Arab Republic and Turkey. Today, we have launched an appeal for $43 million to support WHO's response in both countries. This will increase as the magnitude of this disaster becomes even more clear. But we need to take the response to the next level to reach all affected populations in all areas. We welcome the easing of sanctions by the United States of America. We welcome the recent blanket approval by the government of the Syrian Arab Republic for the UN for cross-line convoys, as well as measures to increase cross-border access. We hope this continues. I'm waiting to move across lines to the northwest, where we have been told the impact is even worse. Earlier this afternoon, I met with His Excellency President Assad, who indicated he was open to considering additional cross-border access points for this emergency. Once again, WHO is committed to supporting the Syrian people now and in the days, weeks, months, and years ahead to respond to this disaster and to build a stronger health system for all Syrians. I thank you, and Nika, back to you.
Thank you, Dr. Tedros. As per usual, if you have a question, please raise your hand. Make sure your name and your outlet are clear when you ask your question. We will only take one question per outlet, and you will unmute yourself. First, we will go to Nina Larson. Nina, over to you. Please unmute.
Hi, thank you very much for taking my question. Already the death toll from the catastrophe has climbed past 33,000. And I'm wondering, after seeing and witnessing the devastation that you've seen there, what you estimate we might be looking at. I mean, there are a lot more people under the rubble still, what we might be looking at in terms of the final death toll from this tragedy. And also, if you have any estimate of, in Syria, northwest Syria, the situation has been much more difficult. Aid has taken a lot longer to get there. They don't have the heavy machinery. How many more deaths do you think that may have caused? Thank you.
Dr. Brennan, would you like to speak first?
Thanks. Thank you very much for the question. I don't think that we can really come up with accurate projections of the total number of deaths at this stage. We do know that the numbers will continue to increase, and we're still waiting on more information from the Northwest. The data that we have available to us right now is that there's been around 1,400 deaths, around 2,500 injuries in the government held areas, and around 4,500 deaths and 7,500 injuries in the Northwest. But we know that those numbers will continue to increase as we get, particularly as we get more access. Even over the last couple of days when we were in Aleppo, we knew of additional buildings that had collapsed and injuries and perhaps one or two deaths associated with that. So all we can say at this stage is those numbers that we have will continue to increase.
Thank you. Our next question is from Yuri Akrelev, RIA. Yuri, over to you. Please unmute.
Good morning. My question is, do you cooperate with Russia in the distribution of humanitarian aid in certain territory of Syrian territory? Because Russian soldiers are, as you know, in Latakia, and are they helping WHO, and are you cooperate with them? Thank you.
Dr. Shankiti, could you take that one, please?
Thank you for your question. Actually, what's important to note is that usually these discussions are held by OCHA. So in order for us to do any crossline or any type of support crossline, usually the discussions with the different parties happens through OCHA, because usually these are interagency convoys that include many UN agencies. So it's not a WHO directly, having this discussion with Russia or any other partner. So thank you for your question.
Thank you. Just a reminder to those who are online, if you have a question, please raise your hand. When we go to you, please state your name, your outlet, and ask one question. We're going to go to Mohammed Mansour. Mohammed, over to you, and please unmute.
Hello, this is Muhammad Mansour from Sharqa News. I would like to ask about the main differences between the situation in Syria and Turkey in terms of ads and equipments. Thank you.
Thank you. Today, our focus is especially on Syria. Dr. Mike Ryan, we can come to you for an overview of what we've seen here. Do you want to take the question?
Right here, the end of question aid and something. Sorry, I
Could you
didn't quite
restate
hear.
the end of that question, please? So it was a difference between Turkey and Syria in what respect? Mohammed, you may need to unmute yourself again. Can you just clarify that last part of your question? You'll have to unmute. We're not unable to get that at the moment.
Well, I can just try and make a few comments. It's difficult and sometimes misleading to compare the impact of a natural disaster from one zone to the other. So much depends on the underlying event itself, the earthquake, on the population density, the extent of that earthquake, and the nature of population density in an area in terms of who's immediately impacted and the type of housing that's there, whether the earthquake strikes in the day or in the night. There's so many different factors that affect the actual impact. Then, and that's the threat associated with the earthquake. Then there are the issues of underlying vulnerabilities in the system. In other words, the capacity of the system to react both in terms of search and rescue and in terms of bringing aid to the injured and taking care of people's needs in terms of shelter and in terms of food and nutrition and access to clean water. So those two factors are at play. It's certain that the impact of this disaster across both countries has been vast. And it's certainly had a massive impact both in built up urban areas and in rural areas. But the challenges there are different for both populations then. There may be less direct death due to falling buildings in a more rural area, but then people are cut off from services that they can't be accessed. So I think the biggest worry right now, certainly we've seen the response here in Syria, and again, I think a lot of respect to Syrian frontline health workers, doctors and nurses and frontline responders, and we witnessed local staff carrying out rescue and recovery operations yesterday. This has all been done by Syrian professionals in the field taking care of their own people. Our job is to be here, as we are in many crises, to support them and make their work as effective as possible. There's no question, certainly on the side of Turkey, there's a massive experience in Turkey in terms of search and rescue, in terms of disaster response. They've had their fair share of disasters in the past. But I think what's clear is that this disaster has overwhelmed everyone. The very nature and scale has overwhelmed everyone. I think what everyone's most worried about now are the people in Northwest Syria who haven't had access to the kinds of search and rescue services, the heavy lifting equipment, who are already very vulnerable because of their lack of access to health and other issues. So there's a general concern that that population, even not knowing the full extent of the deaths and the injuries, but making a very, and looking at the work of the white helmets and others who do such wonderful work there, it's incredible. But it's very, very hard to do effective search and rescue if you've got buildings down and you don't have heavy lift equipment, if you don't have specialist expertise. And now we're in a recovery phase in terms of many people have died, and their bodies must also be recovered. They're grieving families, and it's very, very difficult to continue to do that. So I think the general increased concern right now, and Tedros has spoken to that. He spoke to the concern, his own attempts to be able to move across lines, the need for convoys to move across lines, the need for increased cross-border access. That's notwithstanding huge suffering of the people of Turkey and the huge suffering of people in greater Syria. But I think the major concern for health is now very much focused in the Northwest.
Thank you, Dr. Mike Ryan. Our next question is Imogen Folks. Imogen, BBC, please unmute and go ahead with your question.
Hello, thanks for taking my question. It's also focused on the Northwest. Dr. Tedros, I think I understood you rightly. You are waiting to go. You would like to go yourself into Northwest Syria. Do you have a date? Have you agreed a time? And supplement to that, since the earthquake struck, have there been any cross-line deliveries into northwest Syria, or is it just the pre-positioned stuff which we knew was not at full capacity? I think is it just that's been distributed?
Start with Dr. Brennan on the Crossline question, and then we'll come to Dr. Tedros.
Yeah. To date, there's been no cross-line deliveries since the earthquake struck. We did have one scheduled in the next couple of days. We are still negotiating for that to go ahead. Even prior to the earthquake, the UN system was planning a significant expansion of our cross-line work. And now from one convoy per month up to 3 or 4 convoys per month. That was the plan before the earthquake. And of course, recent events makes that cross-line option that much more critical. But we are working very, very hard to negotiate that access. You've heard the Director General say from this side, we have blanket approval. We are working with our UN partners on the negotiations to get that access and move as quickly as we can. We're ready to go. As soon as the access is given, we will go.
Dr. Tedros?
Yeah, thank you for the question. We're on standby, actually. We can move anytime now through the coastline to the northwest. Based on the blanket permit, we have already permission from this side. We're waiting now to hear from the other side. As soon as we get that, we will cross to the northwest.
And what I just by saying, what we need is massive access from all sides. We need all modalities in operation here. I think we've been clear on that right the way through the last number of years, that we need a whole of Syria approach. We need all modalities to access people in need, and never has that been truer than right now. We need cross-lines access, we need cross-border access, but that needs to increase. I know there are compromises to some of the cross-border side. There have been difficulties with logistics and damage. This needs to scale up. I believe there will be a whole series of convoys in the coming days. But certainly from WHO's perspective, we're ready to go through both modalities at any moment, as long as the necessary permissions arrive.
Okay, I would like to add maybe just a little bit, because initially, I mean, the first 24 hours, the support was from the pre-positioned supplies in Northwest and in Aleppo and in Latakia. But there's a recent flight that has arrived with 37 tons of supplies, and basically supplies that would treat, trauma care, provide support to trauma care and pneumonia. And they are being transported. They have been transported and delivered into Northwest. I mean, as we were informed. But from our side, from the government controlled area, there's also an additional a plane that came 2 days ago, and it also had supplies, trauma kits and pneumonia kits. And there's an additional plane coming in today. So as Dr. Mike has mentioned, and also as DG has said, we are trying to adopt all modality approach in order to access the people that need the support in terms of trauma care and basic services.
Thank you, Dr. Shankiti. Just remind journalists that if you have a question, please raise your hand. I see a few outlets there, but we don't actually have any raised hands at the moment. If no one raises their hand in the next few seconds, we'll go to our panelists to see if we have further comments, but we'll wrap. So just giving you one more chance. Nina has a follow-up question. Nina, given the circumstances, I think we'll go to you. You know the drill. Please unmute.
Thank you very much. I was wondering on the secondary crisis that you're seeing here, how dire you're expecting that to be from what you're seeing in terms of illnesses and also people in the cold, and what you think the main danger is right now for the people who are being rescued or still out in the cold. Thank you.
Dr. Brennan, would you like to start, or Dr. Brennan?
Yeah, so the secondary impact, we often talk about the number of deaths and injuries following an earthquake. But what we have to keep in mind is that around 10 million people have been impacted in some way across northern Syria. And in the governorates of Aleppo and Latakia, around 350,000 people were left homeless acutely, just suddenly. So providing mass care for them is an enormous undertaking. A large proportion of them now are being accommodated in around 127 collective centres, mosques, schools, churches, and so on. And the conditions, we visited a number of these collective centres over the last couple of days. The local communities are doing their absolute best to meet the needs, but they have been overwhelmed. There's overcrowding, there's poor sanitation. Nonetheless, I think the local communities and our NGO partners in WHO, we've been able to extend healthcare and food to most of those communities. But they're not acceptable living conditions, so we are working with partners to look at other options. WHO's kind of approach, in addition to the trauma care, you've heard the Director General talk about our other priorities right now. There's the risk of infectious diseases, again, because of the overcrowding, because of this disruption of water and sanitation. We already had pre-existing outbreaks of cholera and measles, so we're working to step up our control of infectious diseases. Director General also mentioned the mental health problems. We already had a very successful mental health program in northern Syria that had worked throughout the conflict. We've tapped into our networks of mental health care providers, done some initial acute training, and again, stepping up our work in that regard. And of course, access just to regular essential health services. We've been running mobile clinics now to these collective centres, putting in emergency medical supplies into clinics and hospitals. So these are all these are some of the secondary effects and some of the steps that we are taking to address them.
Thank you, Rick. If I may add a few things, because it's important to note that we're not starting with a clean slate. I mean, the health system has been challenged for the last 12 years, given the different crises and emergencies that it has gone through. I mean, starting with the conflict, but also, I mean, different economic crises, different disease outbreaks, COVID, and right now with the earthquake. So it's important to note that the health system itself is very much challenged. I mean, most recent reports, Syrian report, shows that only 50% of hospitals are fully functional, and the same applies for primary healthcare centers. So this is an important indicator where we are looking at facilities that are not fully functioning or not providing the comprehensive package of care before the earthquake, before the different emergencies that they have been going through. So using this and adding to it the different type of challenges they are facing right now, and the low access in some areas to some of these services is going to impact the health of the population. So this was an important addition to the current situation. Thank you so much. Dr. Ryan?
I think you have said it all. I think this is one of these classic cases where 10 years of war, 10 years of instability have just pulverized this health system to a point where it just cannot deliver adequately for all its people. And I mean pulverized. I mean, that's not only physical damage to the infrastructure itself, but the exodus of health workers, the loss of salaries, loss of training. It's just been that death by 1,000 cuts to the system, and then the system has reacted admirably to what's been a massive disaster. But people can only do so much when they're tired. People can only do so much. I think we saw a CAT scanner yesterday, the only CAT scanner in Aleppo, and it's broken. There's no spare parts. That's a tragedy. Someone dealing with patients with complex injuries. So we need to put the means and the tools in the hands of our health workers, wherever they are in the world. Let's leave aside the politics. This is a population of people who have been suffering for a decade, and this latest suffering in both Turkey and Syria is just horrendous. I just have a sense that on the one hand, people are broken by this. I think one old lady said yesterday that throughout all the war, the house was damaged. There was a crack in the wall, but it took the earthquake to bring our house down. And you know, these stories that people have, their resilience is incredible. Their ability to survive is incredible. But these people need stability. These people need peace. You can't build a health system in a situation like this. You need stability. You need to be able to build the workforce, build a health system, and deliver much more care. We met our WHO staff here today, and you know, they were talking about just the need for psychotropic drugs, simple drugs for chronic diseases, people not getting cancer therapy. And again, we hear these stories all over the world, and yet these are cheap, simple, available treatments, but the system isn't capable of delivering them consistently to people. That's the tragedy. The tragedy on top of it is the earthquake, which has just further exposed how fragile the health of the population of all Syrians is right now, no matter where they are. And solutions have to be found to bring stability, or we can't bring a health system. We can put band-aids on wounds, we can fix broken bones, but you can't fix the lives of people. You can't fix the life course. You can't bring health for life in a situation where people fear for their lives. So I think we have to change the equation in order to deliver sustainable healthcare for all of this country.
Thank you, Dr. Ryan. Next, we have Nick Cumming-Bruce, New York Times. Please unmute and ask your question.
Yeah, thank you for taking the question. If I could just come back to the Crossline story and clarify a couple of points. The understanding from what you've said so far is that there's blanket approval already available from Damascus to send Crossline convoys, but you're not actually in a position to send the convoys just yet. So I wanted to clarify what exactly you're waiting for, whose approval are you waiting for at this point? And in addition to convoys, I wonder, are you also planning to deploy mobile medical teams into those areas? Has it been possible to send any of those across the border from Turkey so far? What capacity do you have on the ground? And you've mentioned that only half the medical institutions in facilities in Syria are working. I wondered, what information do you have on the number of health facilities actually in opposition-controlled areas that are fully functional? Thank you.
We'll take this over to Dr. Brennan. Dr. Brennan, over to you. I know it was a series of questions.
Okay. The approvals, there are, I think, Nick, you're familiar with the situation in northwest Syria, so we are waiting for approvals from the other side, from entities on the other side, and as soon as we get those, as indicated before, those cross-line missions will go ahead. In terms of the emergency medical teams, we don't need emergency medical teams that's coming into to Syria at this point in time. WHO has brought in a trauma specialist who's worked with the local providers here and the surgeons and emergency physicians. We've already done a rapid assessment. They've scaled up, heroically. So we don't need the emergency medical teams here in the government held areas of Syria. In the northwest, we still haven't been able to do a full enough assessment, but we have 3 emergency medical teams that have indicated an interest and willingness to go into the northwest. We are exploring that option right now. A lot of considerations, as you would be familiar with. In terms of functionality of health facilities, there's only 51% of health facilities across Syria prior to the earthquake that were fully functional. There's another 25–30% that are partially functional. We don't have as good data from the northwest. That's because facilities come and go. But I think that we could estimate probably similar figures. That there's a lot of the work is done through mobile facilities as well. And you know that the bulk of the healthcare services in the Northwest are done through NGOs working cross-border. And I might just add our own support to those healthcare providers working cross-border. We've talked about the pre-positioned supplies. We, like other agencies, we had pre-positioned supplies in the Northwest, as Dr. Shankidi indicated. They were rapidly distributed to 16 hospitals and 68 health facilities in total. We've had 74 tons of medical supplies, 7 trucks full over the last couple of days. We're going to be participating in the next convoy, the next UN convoy, which we hope goes in the next 48 hours. And we've got 2 more air charters coming in probably the next 4 to 5 days, all bringing supplies into Turkey for Northwest Syria, in addition to the air charters that Dr. Shankidi had already referred to for here in Syria, in the government control areas.
Thank you, Dr. Brennan. We're going to wrap with apologies for those we haven't been able to reach yet. Dr. Tedros, any last words?
Thank you. So I'd like to thank the members of the press for joining us today, and see you next time. Thank you.
Thank you also for your patience. We apologize for the delays, and as usual, the audio and video files and the Director General's remarks will be made available to you shortly. Thanks again.